public backlash growing against our country's top health official, RFK Jr., as more Americans stand up to the Trump administration. One of RFK Jr.'s most controversial moves thus far, firing every single member of a key CDC vaccine advisory committee and replacing them with people who have a history of attacking vaccines and spreading misinformation. Former members of the CDC vaccine board slamming the health official, saying the move, quote, may roll back the achievements of U.S. immunization policy, impact people's access to life-saving vaccines, and ultimately put U.S. families at risk. They're not alone in their warnings. One senior advisor on vaccine policy at the CDC, Dr. Fiona Havers, resigning this week after more than a decade at the agency, saying she can no longer work under RFK Jr. as he dismantles key processes. Dr. Havers telling the New York Times, quote, if it isn't stopped, a lot of Americans are going to die as a result of vaccine-preventable diseases. Dr. Fiona Havers joins me now. Thank you so much, Dr. Havers. I'm very excited about this because I think we hear and we see videos of how RFK Jr. behaves, but you're at the CDC. You've had to have interactions with this person. Just as a manager, just as someone responsible for a government agency, does he just come off as incompetent? Is he just disinterested in the expertise of the people in the building? What is he actually like to work for now that you're finally free?
I'll be completely honest. I have not had any direct interactions with RFK Jr. My role is really to generate the data that informs vaccine policy. And my main role at CDC was overseeing a large hospitalization tracking system that provides a lot of the data and the science so that CDC could make science-based, evidence-based policy decisions. So I don't interact with him personally, but I certainly have seen the impact that he's had on the agency.
Is that impact purely scientific, meaning replacing people who are actual experts with crackpots and theorists? Or is it also philosophical, meaning do you find that people who perhaps have a more holistic view of taking care of public health are being pushed aside in favor of people who want to go after sort of idiosyncratic conspiracies?
Well, one thing I would say is that the career CDC scientists that are still there really do care about science. And I do think that a lot of the data coming out of CDC is still solid. But what happened this last week when he fired the advisory committee was really him putting in people that are going to take those data and not use them appropriately, no longer do science-based, evidence-based vaccine policy. What happened over the last couple of weeks has basically been that RFK Jr. has blown up vaccine policy for the United States. For me, one of the major other precipitating events was that on May 27th, he went on X and announced that CDC had changed the COVID immunization schedule. CDC was not involved in that. No one who does COVID vaccine policy was involved in that decision. And that is also now not how the CDC immunization schedule is changed. And the reason why this is important, I do want to clarify, what's on the CDC immunization schedule matters for insurance coverage. If that has changed, Americans lose access to vaccines. If the people that he's installed in this new committee restrict vaccines and change recommendations so they are no longer recommended by CDC, Americans will no longer have insurance coverage for these life-saving vaccines. And even if they want to get them, they may not have access. That's why this matters.
Dr. Havers, one of the key things that you said in your interviews, you said, look, people are going to die because of these policies. I am someone who's really dedicated to not catastrophizing when I'm behind this desk, but I do want people to understand how serious things are. Let's just play this out heading into flu season this fall. What could be the impact of RFK Jr.'s leadership on the health, the life and death of people in this country once we hit flu season, given his philosophies?
Yeah, I mean, so currently influenza kills thousands of Americans every year, most of them older adults. If, for whatever reason, there is restrictions on recommendations for influenza vaccines, which is much less likely than COVID vaccines, but if that happens, I think, and fewer older adults in particular, or very young children, or pregnant women are not vaccinated, there could be an increase in flu deaths. I mean, I'm a physician. I spent my entire career working on vaccine preventable diseases, but I also see patients. I have the honor of taking care of patients at the Atlanta VA and taking care of our veterans. And so I've seen people die of vaccine preventable deaths. And I think if the CDC immunization schedule is meddled with and it is restricted in any way, fewer people are going to get vaccines. That may be because their insurance no longer covers it, which is a very real consequence of any changes to the CDC immunization schedule. And because there's increased confusion in terms of who should be getting what vaccines. I will say also, like the CDC, clinicians across the country rely on this immunization schedule. And it is also generally, when there changes are made to it, it is endorsed by all the professional societies. So the American Academy of Pediatrics, the American Medical Association, they all have a voice and weigh in on this very complicated process to make a change to the CDC immunization schedule. And if if this turns into a process where RFK Jr. announces on Twitter that CDC changes the immunization schedule, all of those voices are cut out. The implications, the really nuanced implications of how exactly the CDC immunization schedule is worded is lost. And people who should be getting vaccines are going to lose coverage, lose access. There's going to be increased confusion, and patients and clinicians won't know where to turn for reliable vaccine information.
Dr. Fiona Havers, thank you for laying out how dangerous this is. And I congratulate you for your bravery and stepping up and speaking about the danger that we're facing as a country. Thank you so much.
All right. Thank you very much for having me. Appreciate it.